Welcome to the Hashimoto's Doctor Podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hi everyone, Dr. Shook here. I hope you're doing well today. In today's podcast, I want to continue on one of the previous topics where I have discussed a little bit about nutrient deficiencies and the role that they can have in thyroid physiology disruption or suboptimal thyroid function. There are lots of different ways that lacking or deficiencies with nutrients, and in particular, one of the nutrients we're going to talk about today can create a lot of problems for your thyroid physiology. And this is something that a lot of people, they don't really consider, and they just know they don't feel good. They go to the doctor, they get their TSH checked. It tends to be, let's say it's high in this example, which would suggest low thyroid hormone circulation, low T4. It would suggest that there's a problem with thyroid hormone production. So the doctor then prescribes a thyroid hormone replacement to try and help the person with their symptoms, right? And to lower that TSH, which is an indirect measure of circulating thyroid hormone. The problem becomes, and the question that you need to ask is, why? Why do I have a high TSH in the first place? Why is my thyroid not making this? That's where you really, I'm not saying that the medications aren't necessary, because they help millions of people, and thank goodness that those are available for us. But the question that I encourage everyone to ask is always, repeat this question in your head anytime you're given an explanation for something, especially as it relates to your thyroid or your physiological processes of your body, is why? Why is this happening? Why is my body adapting in this way? Why is my gland no longer making enough thyroid hormone? Why is that occurring? Right? So it's low thyroid hormone, or it's, the probability is that there's low thyroid hormone, but why is that occurring? Thankfully we have thyroid hormone replacement therapy that can help replace the hormone. But what you want to try to understand is what is also these underlying mechanisms, because what if there's something that you could do to support that naturally? Or what if there's a process that's ongoing that could create a lot more problems for you in the future? What if this is, you're just supporting your treatment that the doctor is giving you is supporting a symptom that makes you feel better. But what if the underlying cause of that symptom can actually lead to a lot more problems, and you're just simply covering up the symptom with the replacement hormone? Which, I want you to understand that if you're deficient in thyroid hormone, or your doctor recommends thyroid hormone replacement therapy, absolutely, you cannot be deficient in thyroid hormone. Follow those recommendations. That's a critical vital to life hormone. You cannot be deficient in thyroid hormone. If you are, it's going to create major problems for you. So, but you always want to be thinking why. So as far as, what are the top causes for hypothyroidism or low thyroid hormone output, or high TSH, right? A high thyroid stimulating hormone is is how you're actually diagnosed as hypothyroid. You have a high TSH. So what causes these things? Well, the number one cause is what? You should know this, especially if you listen to my podcast. What's the number one cause of hypothyroidism, which could be and would be reflected in your blood work as a high TSH? It is Hashimoto's, an autoimmune thyroid process that is the number one cause of hypothyroidism in the United States, and probably, around the world, the number one cause of hypothyroidism is an iodine deficiency. In the U.S. and in industrialized countries where the food supply has been fortified, there's iodized salt, then the number one cause is not a deficiency in iodine. It's actually Hashimoto's, an autoimmune thyroid process. So, around the world, iodine deficiency is a big deal. It's a big problem, but we don't see that, very frequently in the U.S., though it can be a contributing factor. And just as a caveat here, guys, I would be very cautious supplementing with iodine unless you have unless you have testing to support your need for iodine supplementation. That's something we always recommend that people do. But back to our topic. So the number one cause is Hashimoto's. But as far as deficiencies go, nutritional deficiencies, how do they play into hypothyroidism? Well, very interesting study that was done in, when was it? 1994. Okay, listen guys, that seems like a long time ago, doesn't it? But here's the reality of the situation. There's a lot of great research out there that very few people, try to understand and reflect upon and try and get a better idea of, what's driving our symptoms. Everyone wants something that's brand new. Well, you know what? I'm sure if you did a search on PubMed for this data, you're going to find more than one source. But this was in 1994. It's a great study. This was actually based on zinc supplementation. And the title of it is Zinc Supplementation Alters Thyroid Hormone Metabolism in Disabled Patients with Zinc Deficiency. Okay, so this is really powerful. What they found was that supplementation with zinc resulted in their levels of their serum-free T3. So it increased levels of their free T3, which is the physiologically active thyroid hormone. It reduced levels of reverse T3. Reverse T3 is basically a brake. It blocks thyroid hormone receptors, and it will create a lot of problems for you if it's high and if it's elevated. And we see that a lot. And really an important thing to understand here is that there are ratios. You need to understand the ratios. There should be, you should have a certain ratio of reverse T3 to total T3. You should have a certain ratio of free T4 to free T3. And that's really important to understand. It's not just the lab range. Is it within the lab range? You also want to understand some ratios. That's really an important thing to consider. But this zinc supplementation increased free T3, which is huge. That's the physiologically active hormone. Reduced levels of reverse T3, which is also very significant because that blocks thyroid hormone receptors, and it normalized TSH levels. And now that makes sense if you start thinking about some of these other biomarkers that were changed here, especially if your free T3 goes up, which stimulates your physiological activity of the cells. That's what the form of thyroid hormone that the body primarily uses. That's going to have as those levels rise, it's going to have a feedback or a signal sent. It's going to send a signal to the brain that the thyroid hormone levels are increasing. And so the brain can say, okay, there's enough in circulation, so I don't have to keep signaling the pituitary gland to pump out thyroid stimulating hormone, because we don't need to continuously we don't need to stimulate the thyroid at this rate because the levels of circulating thyroid hormone is coming up. So I can back off of the gas pedal. Okay? Does that make sense? As those levels come up, the brain is monitoring these levels, recognizes that these levels are increasing. So the brain then says, okay, I'm going to back off of the gas pedal. I'm not going to signal the pituitary gland to produce as much thyroid stimulating hormone. I can decrease the amount of that hormone so that I'm not trying to continuously rev the engine of thyroid hormone production. Okay, so that's a really important thing to understand. So this is huge. And now you might say, well, why did zinc supplementation have an impact here on thyroid hormone physiology? And what the likely mechanism is that zinc is a cofactor in a lot of different processes, but especially what we see for the thyroid receptor. So part of the cell that is sensitive, or the thyroid receptor is the receptor on the cell. So it's kind of like, some people don't know what receptors are, but and that's okay. They're a docking station, or a place where your thyroid hormone will attach itself to the cells of your body that allow the cell to respond to the thyroid hormone. So the thyroid hormone attaches itself to the receptor, and that then triggers these changes inside of the cell that ramp up the metabolism of the cell itself, the energy production of the cell. It helps the cell carry out its physiology, its normal processes. And so whenever you have a zinc deficiency, some of those processes may not occur normally because zinc is required as what they call a cofactor. So hope that helps you to better understand some of these issues. Zinc is important. There are a lot of nutrients that are important. There are so many ways the thyroid breaks down. I hope you guys understand that there are a lot of pieces to this puzzle that we often have to put together. But I hope this helps you to better understand nutritional deficiencies, especially zinc. If you have any questions or you need anything, please don't hesitate to reach out to my team and I, and we will do everything that we can to help you. Remember, it's my mission to help you improve your health. If we can improve your health, and we can change the world one person at a time, because that will have a positive impact on your family, your community, and ultimately the world. So if you need anything, you have any questions, let us know. Remember, it's my goal to help you be your own advocate so that you can be a better partner with your healthcare provider. You can be an active participant in your healthcare, and you can be more empowered to make better decisions for yourself. So I appreciate you. Hope you have a wonderful, wonderful day. Look forward to hanging out with you again soon on the next podcast. Thanks. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.